Hello, I'm Donna Butts, Executive Director of Generations United. Welcome to our webinar on Cultural Responsiveness and Intergenerational Programs. I'd like to begin by acknowledging the Indigenous peoples of all the lands we are on today. While we gather on a virtual platform, let us take a moment to recognize the importance of the lands which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. Please join me in a brief moment of reflection to acknowledge the past and to consider how we are and can, in our own way, try to move forward in a spirit of reconciliation and collaboration. Thank you. At Generations United, we believe that all levels of society are stronger when we build and support connections between generations. To be effective in our work, we are committed to using a diversity, equity, and inclusion, or DEI, lens that recognizes collective and individual cultures, values, norms, ages, lived experience, and practices that offer opportunities and supports for people of all ages. We've embarked on a journey to be deeply intentional around DEI issues and practices across the continuum of our work. We are honored today to co-host this webinar with our partners at the National Indian Child Welfare Association, NCWA, and the National Caucus and Center on Black Aging, NCBA, who've been working with us to elevate and support intergenerational programs that are inclusive and culturally, racially, and ethnically diverse. Thanks to the support of the RRF Foundation for Aging, Generations United has launched our Diverse Intergenerational Programs Initiative. This project includes reviewing and updating existing definitions and tools to truly reflect, include, and celebrate diverse programs. We're working to honor the accomplishments of these programs, encourage their development, and support and elevate diverse practitioners and leaders in the field. In addition to partnering with NCWA and NCBA, this work is guided by a stellar advisory group of intergenerational practitioners, professionals, and researchers from around the country. We thank them all for serving and sharing their wisdom with us. Earlier this year, we launched a survey with the goal of capturing responses from diverse communities that may not have felt represented by previous definitions of intergenerational engagement. To date, we've received 149 responses from programs in 28 states and the District of Columbia that are engaging ages from babies to college students and 50-somethings to centenarians. We are still collecting data and would love it for those of you who are connecting younger and older people within diverse communities to complete the survey. The initiative joins a growing body of work at Generations United that addresses diversity and equity in intergenerational practices. In the grand family space, we have published 3 racial equity toolkits designed to give resources and tips to child welfare agencies, other government agencies, and nonprofit organizations so they can better serve American Indian and Native Alaskan grand families, African American grand families, and Latino grand families. So a couple of things before I turn the program over to our phenomenal speakers. We are recording this webinar, and everyone who registered for today's event will receive a link to the recording. So please feel free to share that link with others you think might find it interesting. Keep an eye on the chat box because Generations United staff are juggling and doing a phenomenal job of sharing links to relevant resources. And finally, I'm thrilled to share that we have a really rare opportunity at Generations United. We have an open position on Generations United's program team for Senior Manager of Intergenerational Initiatives. This person will be responsible for leading our diverse intergenerational program work. Please be sure to share that opening with people that you think might be interested and of course would be fabulous, and what might be interested in joining what I consider to be a pretty incredible team of people. In closing, I wanted to briefly just mention I had the pleasure of meeting with the Northland Foundation staff in Duluth, Minnesota last week. There was a staff that's responsible for their long-running age-to-age intergenerational program that we consider to be one of the best rural examples in the country. They told me about a new program that they've just launched, which is called Marauukin, which is a Ojibwe for the distribution. And what they're doing with that program is they're giving small grants to individual tribal citizens, descendants, or those who have kinship ties or affiliation in Indigenous communities in the area that they serve. Many of the first round grantees are doing incredible intergenerational projects that include youth drumming, capturing native language on video so they're not lost, and gathering rice, traditional gathering of rice and processing of rice. I think these are wonderful examples of what we believe in at Generations United. We are stronger together. So now I'm honored to welcome our MC for today, Dr. Sarah Kastelic. She's the Executive Director of the National Indian Child Welfare Association. Sarah's also a member of the Generations United Board of Directors and is a great friend and partner. If you happened to be at our conference last year, you may remember Sarah because she did a fantastic job of moderating what was the most popular plenary session of the conference, Sankofa, the Art of Intergenerational Storytelling. We're including a link in the chat so that if you weren't there or missed it, you have a chance to watch it because it's well worth your time. So it's my pleasure to introduce and thank Sarah Kastelic.
Wonderful. Thank you, Donna. Koyana. Chimai, everyone. It's so good to be with you today. I'm really pleased to share this space with you. And probably like all of you, I'm so excited to hear from our speakers about the incredible work that they're doing in their own communities. For too long, people of color and Native and immigrant communities have been underrepresented in intergenerational programming. That isn't to say that these communities weren't practicing intergenerational relationships and engagement. In fact, many communities of color have long and rich traditions of bringing together younger and older people in meaningful, purposeful ways that are often based around the transmission of culture and the care of elders, and are ingrained in their practices and beliefs. This intergenerational engagement goes beyond being intentional. It's woven into the fabric of communities that practice them. It's part of their way of being. In addition to recognizing the diversity of experience when it comes to connecting young and old, formal programming also needs to make space for a multitude of languages, ethnicities, and identities. Celebrating and expanding the diversity of intergenerational programming has two overarching components. First, making space for ethnically and racially diverse participants and staff. And second, recognizing and elevating existing intergenerational cultural practices. Culturally based or culturally responsive programming is critical because it meets a deep human need to belong, to be connected to someone other than yourself, and to be connected to something bigger than you. At the National Indian Child Welfare Association, one of our core values is that our methods of delivering our work have to be just as culturally competent as the content. This means that how we do our work is just as important as the content of the work. And both the how and the what we do are grounded in Native cultures. While new practices and programming are being developed in communities, often these intergenerational ways of being together are ancient. And we know that they're effective because they've often been passed down for hundreds or even thousands of years. An important value in many Native communities and in many Indigenous communities throughout the world is interdependence. And we know that we need one another, that our well-being is bound up in our relationships, especially in our intergenerational relationships. Today, we have the privilege of hearing from three wonderful speakers about the culturally responsive intergenerational programming that they are leading. And trust me, you're going to be really inspired. It's now my pleasure to introduce our first speaker, Marva Overton, and we're going to start with a video about her program. Marva is the Executive Director of the Alliance for African American Health in Central Texas. She's going to begin her presentation with a brief video that paints a picture of her program, Intergenerational Gardening, Soul to Soul. Welcome, Marva, and thank you for being with us today.
Intergenerational soul-to-soul gardening is a chance to bridge the gap between generations. I've been amazed at how it has impacted some lives.
Intergenerational gardening is all about youth, adults, and seniors coming together to have fun, to increase access to healthy foods, get physical activity, and get to know one another better.
My favorite part is getting out with nature. The vegetables we've planted, you see from start to finish how they've grown, and that's exciting. You know, just like seeing your child grow from baby to adulthood.
To make a garden grow, it takes time, patience, and dedication. We get to see how different each type of plant grows. It's kind of motivational, you know, seeing things grow. So that's what I love.
The problem is there are areas in the Black community where there isn't availability of fresh fruits and vegetables. It's easier for a youth to go to a corner store near where they live and grab a bag of chips and a soda as opposed to going into their backyard and picking some tomatoes. And you go out in your backyard and pick something, a fresh strawberry.
Without programs like this, we grow farther and farther apart rather than coming closer and closer together. And we have a lot to offer each other.
It's really nice to just connect and talk with them about like the smallest of things that maybe you wouldn't tell like your best friends and talk about.
And so we've shared some things worthwhile with the gardening as well as just with life, just being friendly, just loving each other, to just be full of life again because it's fun.
The joy is seeing something go from just being an idea on paper to above and beyond anything that we anticipated. It really has.
I realized that there is so much that can be gained when people come together for a common purpose. Together, we can make a difference, and together we are making a difference. Well, good afternoon. I hope that short video provided a glimpse of what intergenerational gardening soul to soul is all about. And I always have to give a shout out to the University of Texas Dell Medical School Department of Population Health, because it was through their Call for Ideas initiative that we were able to launch this program. I also want to thank St. David's Foundation for their continued support through their intergenerational gardening, through their intergenerational programming, and definitely to Generations United for the opportunity to share today a little bit about our program. So this program launched in 2019, and it actually started with the recognition of an unmet need in the community. And we realized this need through some previous programming that we were doing around food access. And the need that we realized was that there were many seniors who wanted to have a vegetable garden at their home. They either previously had a garden or they, grew up on a farm and remembered the pleasure of gardening and growing their own food and the nutritious foods that they got from that, but they physically were not able to do the work anymore. And so we thought, well, what if we pair youth with those seniors to provide the physical labor that they needed for their garden? But as we thought about it, we did quickly realize that this was a great opportunity to do so much more than just providing physical labor to the seniors. In thinking about the possibilities, we developed 5 goals for the program. And these goals are to, one, forge greater connections between youth and seniors in the Black community. Secondly, we wanted to increase opportunities for physical activity for the youth, for the adult team leaders, and also for the seniors as their abilities would allow. Thirdly, we felt that this program could provide easy access to seniors for fresh vegetables. Fourth, we looked at it as an economic opportunity. So we wanted to pay the youth and the adult leads for their work while they were doing the work for the senior, and also to offer opportunities, particularly for our youth, to gain some knowledge around financial literacy and money management. And fifth, we thought it was important to create opportunities for participants to learn about food sovereignty, the history of Black gardening traditions, environmental justice, and food policy. So we structured the program by recruiting youth ages 12 to 17 and adult leads who are 18 and over, and seniors who are 65 and over. And we have what we call gardening teams that consist of the adult team leader and 2 youth, and they do the maintenance of the garden throughout the planting season. When we do the initial installation of the garden in the fall or the spring, we generally put 2 teams together as there's more work to be done with the initial planting. We also have gardening classes, so we teach the gardening skills to the youth, to the adults, so that they know different parts of what they need to look for when they go out and are doing the maintenance, the weeding. You know, we even teach them about different, bugs to look for, which ones are good, and that type of thing. In addition to the gardening piece, then I mentioned earlier, we also do these money management classes. We have 2 3-hour sessions with one of our community partners, and that it's very basic, but it helps the youth to begin to think about setting goals and earning money and making decisions of, what to spend and what not to spend. And we also, when we do those classes, we invite the parents to attend, because we think from a family perspective, it's good for the parents and the kids to have that discussion together around family finances. And then thirdly, we have workshops that we call food sovereignty workshops, and a curriculum was created for this program by Dr. Nia Jones. And it really is the part of the program that we are one of the parts that we're very excited about, and that it helps participants to learn and to think about the historical context of food and food access in the Black community. So all of the groups come together, the youth, the adults, and the seniors, again, as they are able, they participate in these classes together and have the opportunity for interaction and the exchange of ideas. So even with those 5 goals that we have, I think the thing that we are most excited about are some of the more intangible benefits that we've seen from this program. And just to give you a few examples, we have a senior in the program who had a very unfortunate situation of being struck by a car in front of her home several years ago. And even though she was physically okay, she really did not go outside of her home unless she was going somewhere. She didn't, go outside in the yard. She didn't sit on the porch. When our gardening team started to visit, she would not go out initially. She would watch from a window. Before they got through with that season, she was coming outside, and she even met one of her neighbors that she had not met. He was more recent to the neighborhood. She had never met him. He came over and looked at what was going on, and they actually met, and then, developed a neighborly relationship after that. We also had opportunities where in the classes I mentioned where everyone's together, we encouraged the youth to share. And we had one youth that was shy And when he spoke very softly. And one of the seniors really encouraged him and to speak up and to understand that this was a safe space and that no one was there to judge him, but rather to encourage him. And so that was something that I felt was very beneficial or uplifting also about the program. We have seniors that have developed friendships where they get together for lunch and they check in on one another even outside of the program. And we also had a mentoring opportunity to occur. One of our leads was a med student, and one of the youth expressed an interest in becoming a doctor. So that adult lead talked to her and gave her some information about her experience in med school. So those are some of the things, again, that maybe are a little more intangible, but I think are really signs of the success of this intergenerational programming. And although the program is still in its infancy, again, we started in 2019, and like many things, we were derailed due to the pandemic, but we got back on track this year with the spring planting. Although in Texas, it was a challenge. It's been extremely, extremely hot here, but we are inspired by what has occurred so far, and we are very much looking forward to the growth of this program and what it will continue to bring to the greater Austin community. Thank you.
Thank you, Marva. Really love to hear that story, and just makes me think about my own family's experience and all the things that I've learned from my grandparents, from the elders in my community about growing all sorts of things. In my garden right now, I have a lot of blueberries coming in, my potatoes are getting bigger, tomatoes are starting to turn red. So thank you so much for sharing that with us. I really appreciate it. Now I'd like to introduce our next speaker, Dr. Danica Brown. Danica is the Behavioral Health Director at the Northwest Portland Area Indian Health Board, so our neighbor here in Portland, Oregon, and a really important partner of NCWA's. Danica is a citizen of the Choctaw Nation of Oklahoma. Welcome, Danica.
Hello, everyone. Halito Achishiokshlubonhili Fijik. I'm Danica. I'm a citizen of the Choctaw Nation, and like Sarah mentioned, I am the Behavioral Health Programs Director at the Northwest Portland Area Indian Health Board. And I'm really glad to just have a few minutes to talk to you about some of the work that we're doing around intergenerational collaboration. We have a number of projects that we work on where we work with elders and knowledge keepers, to serve our communities. And so one of the projects I wanted to highlight today is, and I'm going to put in the chat a link to information about it, is our Elders and Knowledge Keepers Echo. And at the board, we have a whole Indian Country Echo project, and there's, I think, over 20 different echoes, both clinical as well as kind of more communities of practice echoes, addressing a myriad of issues and health conditions. But a number of years ago, we started working on a behavioral health aid training program with the board. And it was very much modeled after a program that's been hugely successful in Alaska. And part of the success of that program in Alaska is that there's a mentoring aspect of that project. So behavioral health aid students are mentored or tied to an elder mentor and cultural advisor in their community. And so that mentor really helps them to develop their understanding of cultural knowledge and history of the areas that they're working with. And so we wanted to, kind of develop that aspect of our project too. And so when we started the behavioral health aid training program, a big part of it was kind of meeting with elders and talking to elders about what is traditional Indigenous knowledge and how can we incorporate that knowledge into the behavioral health aid training component. And so part of it was that we started having a series of gatherings that we called Elders and Knowledge Keepers gatherings. And we invited both elders and knowledge keepers from our communities to participate on that gathering, to both advise on the incorporation of traditional Indigenous knowledge into the training, but also to start recruiting elders and knowledge keepers to be mentors to the students when we started recruiting those students. So part of the reason I want to kind of mention that we talk about elders and knowledge keepers is that, you know, historically, our knowledge was really held by our elders and shared with us in our communities through our oral traditions and story teaching, and you know, through our dances and songs. And then because of colonization, that was really interrupted, and many of our you know, elders now lost that role or that place in our communities because of colonization. They were taken from their communities, they were put into boarding schools, or taken from reservations and relocated to different cities. And so there's this whole generation of folks who lost that knowledge and or just lost that role. And now there's this resurgence of knowledge keepers, of young people who are going out and actively regaining that cultural knowledge. And so they're not always elders. And sometimes our knowledge keepers are youth. They're learning their language, they're learning their customs, they're learning these roles that they have. And so for us, it's not just about knowledge keepers. We want to also honor those, the elders and the knowledge keepers in this really important work that they're doing. And so, so we started the gatherings, and one of the things that came out of the gatherings was we started hearing from them. You know, this also was happening during the beginning of the pandemic, and you know, they were being called on very often to do work in their communities, doing ceremonies, bereavement practices, while navigating all of the new conditions that the pandemic were bringing on communities. And so what we were hearing from them was that they also wanted a space where they could connect and have some reprieve and connect with other elders and knowledge keepers to just have that more of a community of practice. So, so through that, we started the Elders and Knowledge Keepers Echo. And I put a link into the chat with information about that specific echo, but we meet once a month. And we have a panel of elders and knowledge keepers. In the Pacific Northwest, there's 3 primary cultural groups. There's the coastal Salish, there's river people, and then there's the plateau tribes. And so we have an elder and a knowledge keeper from all of the 3 kind of cultural areas. And then we have guest speakers and presenters that come and talk about different topics. We've had Jesse Beers, who is a younger person who he is a skipper on a canoe, and he talks a lot about you know, the canoe journey and the importance of the canoe. But in he's from CT Clusie, and you know, they're doing a lot of reclamation of their cultural ways, including food sovereignty, the canoe journey, hunting and fishing practices. They're doing all kinds of things, and so he's one of the faculty on the panel. And then we have an elder. Her name is Alutiiq, and she's from Yakima, and she is wonderful, and she shares a lot about her culture and her knowledge as a plateau tribal member of the Yakima Nation, and gathering plants and gathering knowledge and doing that. And so we have different people from these different areas that participate. And what we also found was that in the about 6 months that we've been doing the elders and knowledge keepers, is that we have a lot of people, just elders from the community, who are joining into that call to just participate and tell story and share story with each other. But the purpose of it really is to provide an opportunity for behavioral health aides, for behavioral health professionals, and other practitioners to come in and learn about traditional Indigenous ways of knowing. We do have a form, a client form, a client presentation form that people can fill out and ask specific questions of our panelists about how incorporating Indigenous knowledge into people's treatment plans. And then we also have behavioral health aid students who come in. The other part of this is that we do provide continuing education credits, so our providers also can have access to continuing education. And so it's really important for us to be able to bring in these elders, these knowledge keepers in an intergenerational space to be able to share this knowledge so that we can better serve our tribal communities. One of the other projects we work on is called Ceremonies Every Day. And it's an intergenerational, intertribal, and interprofessional collaboration to develop a health promotion initiative in our tribal communities in the lower 48. And so we work with elders. We have specifically young people who share and bring their feedback and energy into this work so that it's more contemporary and engaging for young people. And then one of the other projects that we work on too is around incorporating kind of that relational worldview into all of the work that we do. And I like this picture, this painting that was painted by Christy Belcourt, because a lot of what we're talking about is that relational worldview and bringing back that relational worldview into the work that we do. And the relational worldview is not just around kind of like a partnership or our intimate partners, but it's also around how we engage young people, how important our youth are, our children. You know, at powwows, we have a tiny tot category where tiny tots are that, and they learn about their space and their role in society and their communities from those tiny tot dances. But it's also our relational worldview to our medicines, our first medicines. In this painting, it's represented by that bowl of strawberries, our relationships with the butterflies, with the plants, with the animals, with water, with smoke, with all of these things. That our relational worldview is so important to us that we can't just independently do this work, that we need to do it collectively. And that means bringing in the voice of young people. One of the other projects we're doing right now is we're doing some community conversations around screening and assessment and the barriers and obstacles to it. And through those conversations, we've interviewed practitioners, chemical dependency counselors, tribal professionals, policymakers, but we also just had a conversation with some youth who have been engaged in treatment and what was it like for them to, go through that process. And it was wonderful. They had so much feedback for us and they were so engaging and so bright. And then, a couple of weeks later, we had a focus group with parents and talking to them about their struggles. And then tonight, actually, we're going to be having a community conversation with our elders. So to get information and knowledge from all of our partners, youth are our partners, elders are our partners, all of the different tribal peoples are our partners. Our first foods are our partners, our animal relatives are our partners, our ancestors are our partners. So we really want to incorporate all of that, that relational worldview into the work that we do. So it informs the work so that we're providing treatment and policy and all kinds of even just content, social media content that is grounded in this intergenerational worldview, this relational worldview. And so that's just some of the work that we do at the board and that we're working on with the intention, explicit intention of being intergenerational in the work that we do. So.
Awesome. Koyana, Danica, really appreciate hearing about that and love the good reminders about the relational worldview, about all of the things that contribute to our balance and our health, to our well-being, and how important intergenerational relationships are in that. So again, thank you for your time.
And I just want to explicitly acknowledge that it was Dr. Terry Cross that really kind of brought that language into this work, that relational worldview. And so I just want to honor him as an intellectual ancestor in this work. So
thank you. Thank you. Wonderful. Well, our final speaker is Katherine Kim. She's the program director of the Koreatown Storytelling Program, a program of the Koreatown Youth and Community Center in Los Angeles, California. The floor is yours, Katherine.
Thank you so much. I'm Katherine. I run the Koreatown Storytelling Program, and we launched in 2020 at the very beginning of the pandemic, unintentionally, as a pilot intergenerational program. We've grown a lot over the past 2 years, and this year we'll be launching a full school year program with 2 electives, one in the fall and one in the spring. Next slide, please, Ali. So I want to mention this photo is of our community, Koreatown in Los Angeles, and I want to kind of explain how Koreatown Storytelling Program is housed at the Koreatown Youth and Community Center. We're one of over 24 programs at KYCC. We're a 47-year-old multi-service nonprofit, and we have programs in economic, environmental, health, including mental health and housing programs, among many others. We have over 185 staff, most of whom are bilingual in Spanish or Korean, as our community is primarily AAPI and Latinx. We started an intergenerational initiative in 2017 with funding from the Eisner Foundation, and that is what enabled me to launch KSP, Koreatown Storytelling Program, in 2020. So just a general overview of what I'm going to go over is our agency, our program, some of the events that we had in the past few years, and then, of course, addressing some of the culturally responsive practices that I've learned, and some of the innovative techniques and activities that have kind of helped us along the way. Next slide. So Koreatown Storytelling Program is an intergenerational, multilingual, and multi-ethnic oral history and digital media program that teaches storytelling to high school students and elders to investigate the racial, economic, and health inequities in our community. And that's our website if you want to go on at some point and read some of our narratives. Next slide. So we are a high school journalism program. We were meeting first in semesters, and now we've gone to the school year. Each youth is paired with an elder in the community to do an oral history interview on their life experiences. Our program is trilingual. Here, my student Abby, who is Korean American, but also fluent in Spanish, is interviewing Luz, who is one of our parents of the KSP and a community partner. And our output is photo, audio, video, and print. We have a print publication that is in circulation at the Los Angeles Public Library. Our video interviews are housed at USC. Our audio interviews are housed at the Library of Congress in partnership with StoryCorps. One of the things that we started off doing was meal delivery. So since our program started at the beginning of the pandemic, we initially were thinking of doing these face-to-face interviews. But at the beginning of lockdown, we were unable to do that. So we got on the phone with our elders and asked them what their needs were during that time. And so at the beginning of the pandemic, they were asking for some essentials like hand sanitizer or toilet paper, but they were also looking for meal delivery. And so at that time, there were a lot of meals being delivered by government agencies, but it was like sandwiches or food that wasn't comfortable for our elders. So we partnered with local restaurants to provide culturally appropriate meals for our elders. So we had like Korean soon tofu stew, and then we also had like Guatemalan food for some of our elders. So we were able to kind of give them and provide some of the food that they were asking for and wanted. Next slide, please. So each cohort had a theme, and each theme really related to what we were seeing in the community. So of course, our first theme was on the pandemic. When we responded to some of the needs that the elders were asking for. So this photo on the top right is a woman who was at a vaccination clinic. KSP did help to register some of the elders for the very, very first round of the vaccines when they were hard to come by. In 2021, we studied the garment industry, and that was because we noticed during the pandemic that some of the factories and the factory workers from our community were still going to work in unsafe workplace environments. And so we wanted to interview some of the workers there to find out how their experience was. And then we started looking at elder care in general. So we spoke to gerontologists, but also asked elders what it was like for them to live in, some of them in senior housing, when they were accustomed to to living in multi-generational households. Last year, we investigated the 30th anniversary of the Los Angeles civil unrest by interviewing business owners and people who had lived in Los Angeles in 1992 during those days. So in 1 year, we had over 350 participants in 2021, including 110 older adults. And these are some of our amazing community partners and funders. Next slide, please. So in terms of cultural responsiveness, I wanted to kind of go over some of the things that I learned. I came across this phrase collaborative equity, and as I was searching for it in my email, I couldn't remember where I found it. So I think I must have manifested it, but I've really kind of taken it as my North Star. And what I mean is that we're really going and asking our elders what their needs are and what they want to share with us and what they're interested in doing, what kinds of activities they want. So, you know, on the bottom left, we have our meal delivery there. The top image is actually from a roundtable that we did with Latinx elders who were in Los Angeles, in Koreatown in particular, during the 1992 civil unrest. And that incident in history is kind of always portrayed as like a Black Korean conflict, but it really left out the Latinx narrative that we wanted to capture, document, and explore. The first obvious cultural responsive need for our community is linguistic. So because our community is monolingual elders, we need to make sure that the students whom we pair the elder with is fluent in their language, so either in Korean or Spanish. We do come across students who are not bilingual, and what we'll do is we'll partner them with an intern who is fully fluent so that we're able to do the interview in the elder's mother tongue. We also do trainings with our students on how to work with elders, how to use honorifics in language. Like tu and usted is the obvious one in Spanish, but we have a very formal way of speaking in Korean. For example, we also teach them or remind them when they're greeting their elder that they should bow. So these are sort of cultural competencies and linguistic competencies that we make sure that we're taking care of. Culturally, also, both of our communities, Latinx and AAPI communities, are coming from backgrounds of civil war. And so when we're dealing with the elders, there is historical trauma that we have to be mindful of. So we do have clinical trainings with the youth to explain to them how they need to be very conscientious when they're going through their oral history interviews. We've discovered some really easy entries for us: our food making, gardening, art workshops. And so this is a way for us to kind of open up dialogue for a community that is traditionally reticent. Next year, we will be investigating the LGBTQIA+ community in Koreatown. And I wanted to raise that because our cultural competencies are not just linguistic or having to do with our home countries, but in this community in particular, we're really looking at how the history of the community, as well as some terminology, is really important to educating ourselves and being respectful of the communities that we are learning about. Financially, we also compensate our elders for their time, for their interviews. Like Marva was talking about, like, financial literacy and financial compensation for our very limited income community is important. Over 95% of KYCC's clients are either low income to extremely low income. And then lastly, just listening and asking, really seeing what the community needs. It's part of what we train the youth in oral history, is to make sure that we're really deeply listening to what the communities are asking for. And that's really how we came across this theme. Next slide. So our next theme is, Marva will be happy to hear, we're doing food in Koreatown. The youth came up with this idea. They said they wanted to explore it. And so we are doing gardening workshops. On the bottom right is the traditional Korean plant. It's called ginip. It's like a part of the sesame family, but we are working with a farm that is cultivating Korean heirloom seeds. And so the farmer there will be speaking to us about those practices and cultural diversity in farming and biodiversity. And then the next slide. These are just some of the things that we do to experiment. That's a gardening workshop that we did with our elders. It's a Zapotec pattern that we did in printmaking, and we will be investigating Indigenous communities in Koreatown in 2024. And our two electives this year are screenwriting and podcasting. So I have those images there. And I think that's it. Next slide. Yes, that's it for our program and overview, but I look forward to your questions and thank you for inviting us.
Katherine, thank you so much. And I love that powerful combination of feeding our souls and our spirits with the stories and feeding our bodies with healthy food, especially our traditional foods. So thank you so much for sharing about your program. Especially love to hear the lessons that you've learned over time. So that's really helpful for all of our participants here today. So now I'd like to invite Marva and Danica to join Katherine, turning on their cameras and joining us here on the screen as we move into the Q&A portion of the webinar. And I'm sorry that for the sake of time, we're not able to take questions from the audience today, but we do thank those of you who gave us your questions when you registered. So many of you did send in some questions. So the questions that I'm going to share with our speakers now are a reflection of those. So presenters, thank you so much for sharing your exceptional work. It's exciting to learn about such different intergenerational projects that respond to the unique interests and needs of your communities. So I have a question for each of you, and then a couple of questions that everybody can jump in on. But Marva, I wanted to start with you, and I'm curious about how does Black culture uniquely influence your program design or the interpersonal relationships that you're building?
Well, thank you, Sarah. For our program, we really believe that it was an imperative, to include in there a component that addresses, food access, farming, and how those things have actually shaped the culture of Blacks in the U.S. So the food sovereignty workshops are actually facilitated by our adult team leads. They receive training in that. Then we have a train the trainer model. And it really allows for the participants, the youth and the seniors, to share their personal stories as they relate to food and as they relate to gardening. Seniors talk about their experiences sometimes of, growing up on a farm where, they were growing their own food, and then even where they sold their food to be an economic source of income for their families. We also have youth and the seniors, they do a mapping exercise. So where they're pointing out where access to, farm stands and fresh fruits and vegetables are, grocery stores, really highlighting, even current day inequities around food access. So we felt like, that piece and how this topic of, gardening and food really is deep within the culture. So we definitely felt it was important to highlight that through those workshops, and that the cultural perspective is very essential in the work that we do.
Thank you, Marva. Katherine, you're working with so many different groups, really different cultural identities, different languages. What practices are you engaging in when you're connecting with new communities?
I would say the first thing we do is a lot of research. We, do a deep dive into the communities that we're working in to really understand. And then we go to allies and advisors. Like, we really look for people who know about that community, who are in that community, so that we can partner with them and be really mindful of our practices. So, for example, when we studied the garment district, we worked with a cultural anthropologist from the Parsons School at the New School, and she studied the garment district and Korean businesses to talk about, some of the practices that they had and some of the challenges that community faced. And we also worked with the Garment Worker Center in downtown Los Angeles, and they were really helping to prevent workplace violations and help with wage equity. So we interviewed people through them, and they gave us people who worked in the factories, because we wanted, to find people who were really working there, who were open to being interviewed. And that was our entry point, is to go to a trusted partner. And so now that we're looking into the LGBTQIA community, KYCC had a training with the Trans Wellness Center. They're based in Koreatown. And so we will be working with them. And we've reached out to the LGBT Center, who we've worked with, and also the UCLA Department of Gender Studies. So we're always trying to make sure that we really understand the community that we're working in by just doing focus groups and asking for advice, and sharing our curriculum to have them review and give us feedback, to make sure that we're not missing anything, to make sure that we're doing things appropriately.
Thank you, Katherine. So these are my words, but I'm thinking about what you just shared with us as doing your homework to be really intentional and appropriate about how you approach community, really looking for those cultural liaisons, people who can help you to honor the protocol that's important to follow, and all of those steps as being really important reflections of the respect that you have for the community that you're approaching. So thank you for that description of your process. It's really helpful. Danica, what advice would you give to organizations or individuals who are interested in working with Native populations or tribal communities?
Oh, that's a good question. I think really the main thing is, I think people need to understand that we're not a minority group. We are sovereign nations. We have government to government relations with the United States. There's 567 different tribes, and that number changes all the time. But through that, our relationship with the United States government is based in treaties, the highest law of the land. And through our treaties, there's a trust responsibility that the United States, as well as states in other jurisdictions, have to tribal communities. So there's a trust responsibility that was written into treaty. And so we really need to understand that and understand what sovereignty means, what self-determination means. and what that means for our tribal communities. I think also understanding the impact of trauma, both historical and intergenerational trauma, is a very, very important baseline information that you need to know when you're working with tribal communities. So those two things, our relationship with the United States government as tribal people, as well as understanding historical and intergenerational trauma. Those are the two primary things. And that, I think the third one that I'll add is that culture is prevention. That when we engage communities, and I'm not just talking about tribal communities, it's any community. When we engage people in connecting with their community and connecting with their cultural ways of understanding themselves in this world, it could be preventative. It can help us to mitigate the impacts of historical and intergenerational trauma in the communities that we serve. So those are the three top of my head things, I would say. They're
Super.
big things though, big,
Yeah.
very important things.
Thank you so much. So we are closing in on our ending time here. So this conversation has gone by so fast. It's been so enjoyable and we're learning so much from all of you. I think maybe I'll just ask one more question, which is, tell us a little bit about how the efforts that you're undertaking in your intergenerational programming are expanding the reach or the impact of your organization. So to any of our speakers who'd like to jump in, please let us know what you think about that.
What I'll say is, so the Northwest Portland Area Indian Health Board, we serve the 43 federally recognized tribes in the Pacific Northwest in Washington, Oregon, and Idaho. And we have a delegate representative from each of those tribes that's on our board. And one of the things that I think is just so amazing about our board in particular is that we have an elders and knowledge keepers subcommittee that's part of that board. And so they're explicitly centering the work that our elders and knowledge keepers do and what they bring. But what they've done is actually even mandated that in the work that we do, that we incorporate traditional Indigenous knowledge in that work. So what that explicitly means is that we work in collaboration with our elders and knowledge keepers, including our youth. And so our youth are very, very active in our community and inform much of our work as well as our elders. So just in the last 7 years, we've expanded exponentially just because of that mandate of incorporating traditional Indigenous knowledge and working across generations.
Thank you. And Marva, I saw you just come off of mute.
Yeah, and I'll just quickly add, for us, one of the ways in which this is expanded is just even through our connections with Generations United through the St. David's Foundation, and they're bringing together various organizations who are doing intergenerational programming. And this is also the first time that we've done youth programming. So we've increased in that way, and we are partnering with the charter school, and we have our classes there. And then we have new collaborations of organizations that work in the food access space.
Wow. To me, this sounds like if you build it, they will come. When you're doing the right work, there's a lot of energy behind it and a lot of other partners who have things to contribute to the good work that you're doing. Thank you so much. Katherine, how about you?
Yeah, I'll just lastly say, in our community, a lot of the, when the immigration kind of boomed in our community was in the 60s and 70s. And so those individuals are aging now. And so we're really seeing that there aren't a lot of resources for that community, but KYCC is building housing for seniors. And so we're going to break ground on that soon. And so this program really kind of leads into programming that we're going to see that our community is going to need. Our latest grant we got was from Next 50 in Colorado, and we got some funding for a systems navigator. So we're really going to be able to find, resources and gather them together so that we'll be able to share them. We get calls all the time for someone saying, my mother has Alzheimer's, are there Korean language support groups? Or, it's very individual, but we want to be able to just be able to be kind of a clearinghouse for those resources for our community.
Wonderful, thank you. And we know that clearinghouse model, really thinking about the use of navigators, in particular peer navigators, is so powerful in building social support, helping connect people to the resources they need. So very exciting to hear about the trajectory of your program. So thank you again to all of our speakers, to Marva, to Danica, and to Katherine for being with us today and for sharing your experience and expertise. And thank you to all of you, our participants who've joined us for our conversation today. It's been a real honor to co-host this webinar alongside Generations United and the National Caucus and Center on Black Aging. We really hope you find inspiration from the richness of intergenerational programs that are making an impact in diverse communities across the country and across the world. As a reminder, if you work with an intergenerational program serving a diverse population or community, the Diverse Intergenerational Programming Survey that Donna talked about at the beginning of this webinar is still open, and we're still accepting entries. So please follow the link in the chat and tell us about your good work. Generations United also invites intergenerational programs to apply for the Intergenerational Program certification, with applications due on August 22nd. The Program of Distinction and the Program of Merit designations are based on the criteria that underpin the effectiveness of any intergenerational program. So they're really intended to recognize the rich diversity among programs that involve older and younger generations. A link with more information about that certification is in the chat box. And in closing, I really want to thank the incredible Generations United team, many of whom are with us today. It is an absolute joy to partner with Donna and her terrific staff. Again, thank you all for joining us today, and have a wonderful rest of your day.